Anal fistula surgeries generally has a poor reputation because people often think that the fistula keeps coming back, and you keep hearing that in the community. But the fact is, the fistulas don't come back. They have never been dealt with properly and cured in the first instance. I am Dr. Ravindran Kumaran, a surgical gastroenterologist practicing in Apollo Firstman Hospital, Skeel Park, Punamalai Road. So what is a fistula? Fistula is basically a result of an infection around the anus. Now anus is an organ, right? And there are some anal glands which are associated with this organ. These glands can sometimes get infected, like how we have an infected facial gland which gives rise to a pimple. Same way you can have boils around the anus. Often patients say they used to have, they had a small boil which burst on its own, and unfortunately the same area keeps leaking pus on and off. This is the typical story you hear about a fistula patient. So these anal glands can sometimes get infected. They can get infected, they can subside like how a pimple sometimes subsides on its own, or they can come up to an abscess which bursts on their own, or sometimes surgically is drained. Now if let's say there are 10 people who have this anal gland problem, one of them will go on to form a fistula. So 10% of all anal sepsis or anal infections will be fistulas. Fistula is actually an abnormal communication between the outside of the anus and the inside of the anus. So you have a boil come up near the anus, the boil bursts, so there is a scar next to the anus, right? That scar keeps discharging pus on and off, right? It can be a regular phenomenon, or sometimes the patient says once in a few months time that area becomes painful, swells up, bursts, a little bit of pus, then I'm back to normal. The same thing keeps repeatedly happening for the patient. That kind of has to raise alarm bells. That means the patient has got a fistula. So that outside bit where the pus is discharging has a communication to the inside of the anus, and because of that a little bit of feces goes into the tract, forms a boil, bursts as an abscess. This can be diagnosed by a surgeon who does a rectal examination. So if you examine the patient and if you do a digital examination on the anus, often you can pick up a fistulous opening on the inside. The outside opening is very obvious, the patient knows about it, you can see it. The inside opening can be felt by one's finger if you examine the patient. Sometimes it is not that straightforward. We may require an MRI scan to be able to figure out what is happening, and for a few patients the fistulous problem can be extremely complicated. So when I say complicated, there can be several holes communicating to several holes on the inside. So those kind of patients would often require an MRI to have a clear idea of what we're going to do. Most patients have what we call as a low fistula. What I mean by a low fistula is, for the anus to be closed, and all of our anuses are closed all the time. That is the only reason we are able to walk around, laugh, sing, do whatever we want, because it is closed. We know there are not going to be any accidents. So that is because there is a muscle which is able to close and keep the anus closed all the time. When the fistulous tract is not involving this muscle, it is a low fistula. It is a very simple fistula. A one-off surgery will usually take care of the patient, and they will never have problems again in that area, right? When you have a high fistula, that often goes through these muscles. So you can't do a one-off surgery because these muscles are extremely important for us to be able to have a closed anus. So this kind of high fistulas often require multiple sittings. Now this is why fistulas have a bad name. People say when you do fistula operation it comes back. It doesn't come back. It is never cured in the first place for it to come back. So often you require multiple sittings to be able to cure these high fistulas. So how many people, what is the percentage between low and high? High fistulas will probably be about 20 to 25% of the fistula population. Majority are low fistulas. High fistula patients, as I said, probably require an MRI scan, require multiple sittings, complex surgeries. Low fistulas are extremely straightforward. Fistulas have to be dealt with properly. If it is inappropriately dealt with, or if it is mismanaged, people can cause damage to the muscles around the anus. It is not uncommon for people to have issues with continence, meaning controlling air or motion after fistula operations which are done badly. So you have to be smart selecting the place where you have the treatment done. If you are lucky and if you have a low fistula, it is very straightforward. High fistulas, you have to be wary of where you have the treatment done. Thank you.